what I started to see was patient after patient coming in for the first time with what ended up being metastatic cancer. And we will diagnose metastatic cancer in the emergency department every once in a while, but to start seeing patient after patient with similar stories who missed their cancer screenings, didn't see a doctor, end up with terminal cancer the first time they go into emerge. It was like, this is not normal. So that really started to pang at my conscience. The other thing I started to see as well is major mental health harms, definitely more overdoses, more people with depression. But what really struck me was children who were coming in suicidal, which was not normal, not to see the amount of them, just again, patient after patient who were basically locked up at home. These were parents who followed the public health orders, right? They closed the schools. They told the parents, don't allow your kids to visit friends, keep them at home. And these kids were unfortunately shut up in their homes because their parents chose to follow the orders that the government put out there. And I was like, this is not okay. You need to get your kids out and go visit some friends. Your kids need to have a life. Like, children are very rarely suicidal, but if you lock them up and literally imprison them at home, that's what's going to cause that. And that was the common denominator with all of these kids. So all this was going on during that lockdown, and I was seeing like the Ontario Medical Association and the Ontario Hospital Association all clamoring in the media and on social media for harsher lockdowns. Like, they're saying Ontario's doctors are calling for harsher lockdowns, more strict lockdowns to control the pandemic. And I'm like, no, they didn't even ask us. They didn't send out a survey to see what percentage of Ontario's doctors actually want these measures. They're just claiming to speak on behalf of all of us. And I couldn't stand by silently when I was seeing so many patients being harmed. And it didn't just extend to my patients. I was seeing family members all harmed, separated from their children due to border closures with New Brunswick. Like, I was just seeing like these public health measures were getting out of hand. Nobody was measuring the harms. And I needed to speak up to get the other side of that debate out there. I had one patient who was treated over a year for back pain with morphine, and you think, okay, well, the doctors just refilling their morphine prescription month after month, and then all of a sudden the pain is not well controlled, so they come into the emergency department in an ambulance, and I looked at them, and their back pain was a giant tumor on their liver, right? Like, and it's like, wow, like, it seems so simple, but just a physical examination, maybe it wouldn't have saved their life, but maybe it would have, right? If this was caught earlier, and they would have at least seen that patient, seen that they were wasting away, right? Like, that's not normal for just back pain. So like, things like that are so simple. With just a simple physical examination, you can at least rule things out. Instead, what we've done is we've switched over the responsibility of physical examination to these patients, because so we're like, how big is your leg swollen? And we're trusting that the patient knows how to physically examine themselves, which they don't. And so I think there's a lot of things being missed, especially cancer, because cancer screenings have plummeted. Here in Northern Ontario, we got a newsletter from our cancer center, basically stating that like pap smears, colon cancer tests, and other cancer screenings have gone down by at least 50%. Over the years. So all those patients who could have had their cancer caught early are now going to be found late. And I can tell you, working in the emergency department, that it's a major issue, that patients often would actually just come into the emergency department instead of seeing their family doctors. That was actually overloading the emergency departments, not from COVID, but because that's the only place they could get a physical exam. And so, yeah, it's a major issue. I think telemedicine has its place. If you've already examined your patient and you know it's not something else, and they just need a prescription refill for something you're sure of, then I think that's fine. But to completely throw out physical examination from the practice of medicine, I think is negligence on a level we've never seen before. We had a man who was in his 90s living at his home alone, and then all of a sudden got confused a little bit, ended up going into the wrong house, and then because of that, he was no longer able to stay at home, so we had to bring him into the hospital while he awaited long-term care. At that time, he lost his whole life. He lost his visitors. None of his family were allowed to come visit him. And even though he had no health conditions, like nothing, like was on almost no medications, he curled up in a ball and he died within weeks. And I can tell you 100% that was from the lockdown. That was from not being able to see family or friends and just giving up on life. And that has happened to many hospital patients and a lot of long-term care patients as well.
Are you a professional and want to share your story? Have you or a family member been injured by the COVID-19 vaccine? You can give us a shout at info@policeonguard.ca and use the subject whistleblowers, and we'll get back to you to talk to you about your story.